What's up? Let's talk about these town hall meetings because they're all the rage, and talk a little bit about healthcare. I don't know how much I'm going to say that hasn't already been said, but again, boredom. All right. So these town hall meetings are really a perfect example of democracy working, but being wielded by liars. The big insurance companies are spending a lot of money right now to fill people's heads with lies, which is their prerogative. I'm not going to stop. I don't think that they shouldn't be stopped from doing that. But that's what's going on. What we what we have here is a group of people that don't know what the fuck they're talking about. All right, I'm philosophically against public option or any sort of government-run healthcare program. Really, even Medicare and Medicaid. Philosophically, that's the key word. But I also, even though I'm really against this, I also know what it is and what it isn't. And this public option is not nationalized health care. It's not death boards or whatever the fuck Sarah Palin was saying. Why she's allowed to speak, have not a clue. It's none of those things, okay? I know what it is and what it isn't. That's part of our problem that we're having here, is the dissent is so fucking stupid that you can't even be against it without people immediately jumping to the conclusion that you think it's this, that, or the other. These fucking retards that the neocons and big insurance have cobbled together to bitch at these town hall meetings, I don't know where the fuck they found these people. I don't know. I seriously, I have no idea. But, so don't take this as an example of democracy not working. Take it as an example of democracy working, because somebody does know how to use it. And what the insurance companies are doing is something that you, I, or any other group of citizens could easily do, but our motivation is limited. We don't have as much money, so we'd have to do more work. That's the difference, and people are lazy, which is why not much gets done. So some people are going to try to use this as an example of why democracy doesn't work well. And I think you're looking at it completely the wrong way. I think this is a good example of why representative democracy is sort of the most practical form of democracy. Because right now, if you were to take these idiots, I mean, they don't even know what the fuck they're talking about, right? But one thing I will say about these mobs, which is what they become at these town hall meetings, why the fuck aren't these people being arrested? Or at least kicked the fuck out of the building? Why? Why are these people not being removed from the premises? You can't act like that, man. Act like a fucking adult, alright? I've been to town hall meetings. Not these town hall meetings, but I've been to meetings on issues in the community that people were really passionate about. But everyone waited their fucking turn. Everyone got to say. Everyone got to stand up, say their say. Everyone had that. Everyone was cordial to each other so that everyone could hear what the fuck everyone else had to say. These people are not acting like adults. Frankly, I think a lot of them need to be fucking arrested. If I was a senator right now, having one of these town hall meetings in Michigan, and I was concerned about assholes like these people that have been showing up, I would ask the governor to bring the state police in and form a ring around where I was standing and get these people to fuck out the building if they won't shut up. You need to act like a fucking adult, okay? Nothing's going to get done if you're up there screaming and crying like a little baby. That's not acceptable. You need to go to jail. Cool off and think it over for a night. Anyway, so that's that. So let's talk about the healthcare. I've sort of given in on this. Because really we have two good options, two options that will help us all. We can either offer a public option, or we can seriously change the laws and use government power to force the insurance companies to act like decent groups of people, to fill out their obligations. First I'd like to say, just so that you're aware of any conflict of interest, I currently don't have insurance, and I definitely would fall under what I would think would be any reasonable income bracket to receive this public option for insurance. So let me just get that out of the way. It's not that huge of a deal for me right now. As long as I don't get hit by a car or get cancer or something, I'll be fine. I just go to my doctor and give him like 10, 15 bucks, whatever I got, and he gives me samples and shit for prescriptions. I don't pay shit. But I also have I've known my doctor for a long time. We got a system worked out here. Find yourself a good Jew doctor. But not everybody has that, so I just wanted to get that potential conflict of interest out of the way. The way I see it here is that this is a failure of free market, because there is no reasonable competition for the insurance companies. There isn't. And health insurance is something that everyone needs. Everyone needs to have access to health care. There's not a question about that. At least I don't think there should be. This is an essential thing. Okay, and it's not something that you can just grow. It's not like it's food. You can just grow it on your own. Everyone really needs health care, especially children and people with conditioned cancer, diabetes, whatever. They need this. Okay, I think most people could fucking agree on that. Whether it come from insurance, private insurance, or the government, whatever, people need that. The way I see it is, I believe it is reasonable and within governmental power to force insurance companies to act reasonably. Okay, if the electric companies all decided to charge us $1 million an hour, for electricity, I think it would be within the bounds of reason for the government to step in and say, no, that is unacceptable. If the water companies were charging you $1,000 a gallon, I think it would be reasonable for the government to step in and say, no, that is not acceptable. Because the government is the largest lobbying group for the American people. And that's what that's really what this should be all about, is our lobby, the United States government, going after the insurance companies. Because it is unacceptable for them to drop people that get cancer. It is unacceptable that people with pre-existing conditions can't get health insurance. That is not acceptable under any circumstances, I believe. And I'm willing to suspend my distaste for big government in this situation, because I think this is a situation where big government could be used properly. Some things you don't need it for, some things you do, and this obviously is one of them, because the insurance companies are not going to change on their own. Maybe a public option would cause the insurance companies to lower their rates, which I think would be excellent. And if they could keep themselves on that, I think that we should use private insurance. If the insurance companies can offer people reasonable rates, not drop them for pre-existing conditions, so on and so forth, I don't think we should have a government program. Okay, but obviously it's come to the point where it's just not, the insurance companies aren't going to change anything on their own, and that's why they're trying to kill this bill. So that they can keep the status quo. Because if this bill passes, the insurance companies aren't going to go away, and I don't think anybody wants them to. Most people in this country, but they would be forced to have a reasonable competitor, and they would have to lower their rates. Can the government compete at a much lower level than insurance companies would like to? Yes. But the amount of profit that the insurance companies rakes in is obscene. And that's part of the reason why I don't buy the same argument that people use against the U.S. Postal Service. I think that what this healthcare plan should be, right now, if you say to me, Chris, we have to have some sort of public option, what do you want it to be? This is what I would say. I would say we put ourselves in a 5-year, 10-year temporary plan with a relatively low income bracket that can benefit from this, okay? And people who might make a little bit more money than that, but aren't in companies that offer health insurance. Do the 10 years and see how much of a loss this is to the government, because I don't think it's quite clear to anybody exactly how much it's going to be. We can't know that until we start the program. I think we should sign a bill that has a 10-year period. All right, we start it now. We go for 10 years. At the end of the 10 years, we evaluate. We see how much fucking money has the government lost. Maybe the government makes a profit. Let's see. Also, let's see what the impact was on the insurance industry. Will the loss in profits, will the loss in income for insurance companies kill insurance companies? I don't think so. And many of the people that are going to benefit from the proposed public option don't have insurance anyway. Okay. So I don't think in any circumstance this is going to be a insurance company killer. Other countries are doing quite fine without their insurance companies, but I don't think we should become. I don't think that we should latch on to too many socialist systems. And socialism isn't bad. It's not an evil, dirty word. I just don't think that we have the money for it. And I don't think it's consistent with what the United States government should be. So let's recap what we're talking about here. I have two options, two things that I would like to see happen. One of the two I would be happy with. The first one would be a complete forced restructuring of the way that the insurance companies run. And I don't really care. I'm not going to cry a tear for these insurance companies. Don't give a fuck, okay? They need to be required to pay benefits to people if they get some sort of disease while under their coverage. They need to have reasonable restrictions for people with pre-existing conditions, reasonable rates, and things like that. That would be option number one, which I think would be actually a bigger increase in government power than public option. Option number two that I would like would be a 10-year trial period for a large-scale public option for healthcare, and let's see what it does in terms of competition, in terms of loss or gain for the U.S. government, and in terms of care provided to people. So that's the situation. The reason that you have to have an income bracket, though, for this is, and the reason that this has to be done slowly, if you wanted to eventually phase out public insurance altogether, is that if there's a public option with no income bracket, a lot of companies are going to cut health care. Just do it because it costs them so much money. And they're just going to cut health care and dump all those people on the government. And that's the problem. And I don't know what's being done to address that. I don't know what the situation is on that. And that's why we need an income bracket for this. As far as paying for this goes, okay, there's so much waste in the federal government that we don't even need to consider raising taxes, which I know is what they're going to do. It doesn't need to be done. There's so much that can be cut, and so much that is flat-out waste. So what we really need is tax reform and a complete reformation of the federal government, really. It's not at all as simple as it sounds. It all depends on what problems you want to avoid. So that's my ideas on that. Maybe somebody else has said that. Maybe somebody in Congress has come up with that. I don't know. Okay. I don't know the situation on that. As far as these town hall meetings go, these people need to not shut the fuck up, but calm the fuck down. I'm perfectly willing to hear what they have to say, even if it's retarded, but they need to calm the fuck down. Or I think they should be fucking arrested, frankly. It's not acceptable. There's a reason that we have right to peaceful protest and not right to mob running around screaming and crazy shit like that. People act nuts when they get angry and get in big groups, and nobody gets them to shut the fuck up. Okay, this is not fascism. Oh my God, the government's cracking down. No. It's a public safety issue. We can't have riots, and that's what these things are getting dangerously close to being, is riots. And I don't know, man. The shit pisses me off, but that's what I gotta say about that. I'll talk to you folks later.